All right. Welcome everyone to our second monthly Communities Conquering COVID Town Hall. It is fabulous to see you. Thank you so much for joining us. And before we get too much further, I want to take a pause and see if we can confirm that our translation services are working. And I'm going to just take a moment of pause and see if we can hear, make sure everyone can hear Maria Militzer.
We can hear both voices.
Okay. Right now, I cannot hear Maria's, and if you, but she is translating. So as long as you indicated when you signed on that you prefer Spanish language, hopefully you can hear Maria translating the event into Spanish. We also have closed caption available. We are so fortunate this evening to have two very special guests joining us, bringing expertise from the community space, the public health space, as well as the medical space. I first want to introduce Jimena Loveluck. Ms. Loveluck is the Administrative Health Officer and leads the Washtenaw Community Health Department. The Washtenaw County Health Department promotes health and works to prevent disease and injury in our community through a range of community and environmental health programs and services. Prior to becoming health officer on September of 2019, Ms. Loveluck served for 2 years as the health department's first deputy health officer. And we are so honored to have her join us this evening. We are also honored to bring back Dr. Sandra Cinti. Dr. Cinti is a professor of infectious diseases in the Department of Internal Medicine at the University of Michigan, as well as the Ann Arbor VA Medical Center. Dr. Cinti is an expert on biodisasters, and I think COVID-19 has certainly qualified as one of those. He chairs the Washtenaw County Medical Society Pandemic Influenza and COVID-19 Group, and has also been an advisor to local and state public health departments on issues around COVID-19, pandemic influenza, bioterrorism, and biopreparedness. Ms. Loveluck and Dr. Cinti, we are so very happy to have you join us today. Over to answer poll questions with our audience attendees. Trisha, thank you for sharing our questions. The first question shown here in English and Spanish is, have you received the COVID-19 vaccine? Yes or no? Yes or no? Now, only our guest joining us via Zoom will be able to answer these questions. Unfortunately, our guest on Facebook Live and other platforms will not be able to join us, but that's okay. Please answer yes or no. Our second question is, if you haven't received the COVID vaccine, how likely are you to get it? How willing are you to get it? Okay, and our third question, we'll scroll down. If you haven't received the vaccine and you want it, how difficult has it been to get access to the vaccine? Specifically, get a date within the next month or so to receive the vaccine. Please answer those questions for us. All right. Thank you all very much. We're going to close the poll now, and I'm going to hand it over to our moderator and our guest, and Ms. Loveluck and Dr. Cinti. I want to remind both of you that while we are excited and we know we have tons of questions that people have sent in for you to answer, please speak slowly so that our translators have time to translate the discussion, the questions, and your answers into Spanish. Thank you so much for joining us tonight, and we're so excited to have you. Jimena.
Thank you, Dr. Marsh. Thank you, everyone from the University of Michigan and MICHR for hosting this event, and including myself. I'm very happy to join you in this Michigan Communities Conquering COVID event. Bienvenidos, mi nombre es Jimena Loveluck, soy la directora del Departamento de Salud del Condado de Washtenaw. Bienvenidos a esta serie que se llama Comunidades de Michigan Conquistando COVID, una conversación con la comunidad acerca de la vacuna de COVID-19. I wanted to just provide a quick overview of the role that the Washtenaw County Health Department plays in the coordination and administration of COVID-19 vaccination efforts in our county. I know that many community members are anxious to get more information about the vaccine, and many are also anxious to get vaccinated. And I want to assure you that we at the health department, along with the many partners that we work with, are working hard to ensure that we're vaccinating those who are eligible as quickly as possible. The Washtenaw County Health Department has provided almost 20,000 doses of COVID-19 vaccine to community members currently eligible. This week, with an additional 5,000 doses, we will reach almost 25,000 doses provided to our community members. We also are working to support the important goals of the statewide vaccination plan. That means that 70% of Michiganders 16 years of age and older are vaccinated as quickly as possible. In addition, it also means that 90% of doses are administered within 7 days of receipt. And finally, and most importantly, the goal is that there is no disparity in vaccination rates across racial and ethnic groups. Locally in our county, we are working through an equity framework to ensure that our most vulnerable populations have access to vaccination in their communities. We couldn't do this without partnerships, and that includes our hospitals, as well as many other community partners, to ensure that our vaccination efforts reach all who are eligible and who need access to vaccine. And those strategies include not only large vaccination clinics, but it also includes outreach and sending nurses out into communities to vaccinate our homebound seniors. It means working with our churches and other community organizations and neighborhood groups to ensure that community clinics and mobile clinics are available to help administer vaccine. In addition, we are always working to ensure that we provide the most updated, accurate information so that people can make informed choices for themselves. Today, the Washtenaw County Health Department launched a new page on its website to show and share data related to our community members in Washtenaw County that are getting vaccinated. This is an important tool for all of us so that we can ensure an equitable distribution of vaccine. I am so happy to be joined today by with Dr. Cinti. We were just in a meeting earlier this afternoon working on our coordination efforts. I value so much the partnership with Michigan Medicine and our other hospital partners to ensure that we have a coordinated strategy.
Thank you so much, Ms. Loveluck, for that incredible overview and the centrality of the role of the Washtenaw Health Department in keeping all of us healthy. We really appreciate your partnership along a number of dimensions as neighbors, as citizens, as researchers, as providers, as public health advocates, as community advocates. Please know that we appreciate all you do and are very proud to call you a partner. Dr. Cinti, do you have any opening comments to make, or would you like to jump in to the questions?
Well, let's jump in. I would just like to thank Jimena and this group for getting this group together. I think it's very important for us to be talking to the community and letting the community know how we are working together. There's been a lot of misunderstandings about the vaccine and how it's delivered. And I just want you to know that the Washtenaw County Health Department has its most vulnerable people very high in their mind, and that the University of Michigan is working with public health. And we were just at a meeting together, Jimena and I, talking about this exact issue. So I'm just happy to be here and happy to answer questions.
Wonderful. We are equally happy to have you here and the expertise that you bring along with Jimena. And with that, I will hand it over to you, Ms. Loveluck, and let the questions begin.
Let them.
All right. Thank you again. Well, I think this is a really appropriate first question to start out with, Dr. Cinti. Did each phase of the COVID vaccine trial last as long as clinical trials generally last? And a second part, which I can repeat also, is how long is each phase of a clinical trial generally?
That is a very excellent question. And there are different time spans for clinical trials related to vaccine when compared to clinical trials related to other medications. And part of that is that a vaccine is usually 1 dose or 2 doses. And so the trials that were done for both Pfizer and Moderna, they went for 2 months after the second dose of both. And the FDA and the CDC would say that that is enough to know if there are going to be any side effects to these vaccines. A medication, such as a medication for blood pressure, an antibiotic, I'm an infectious disease doctor, will require much longer times in order to get approval. But vaccines, usually the major side effects and the major problems are going to occur even within the first few weeks, but definitely within the first 2 months.
All right, thank you.
Yes.
So this is also an important question, given that our eligible population includes those who are 65 and older. What does the data say about safety in the elderly population?
Very good question. And both of these vaccines, they were heavily tested in people over the age of 65, both Moderna and Pfizer. And to let you all know, this week, the FDA is looking at Johnson & Johnson, and they will have the same number and the same percent of older 65 and over people within the trials. So this vaccine is very safe in that age group. And as a matter of fact, it's been shown to be safer in that age group than in younger people. Younger people have more side effects than the 65 and over age range. I'm 56, so I'm close, but I had muscle aches and pain in the shoulder. And my father, who is 80, had none of those.
Well, and I just have to share, I mentioned our nurses that are going out and vaccinating some of our homebound older seniors.
Yeah.
And this past week, we vaccinated someone who was 105 years old. So
That is terrific. Yes.
Okay. Oh, sorry.
I just wanted to say most people will get pain at the site, but other than that, there have been very few severe side effects.
Thank you. Here's another question. Maybe just going a little more specific. Is there any evidence that the very elderly, so someone who's maybe 80 or older, is there additional risk for them in taking the vaccine? And the person who asked this question shares that they read an article where several of the very elderly in Europe died after taking the vaccine.
Again, that is a very good question. And there has been no evidence. And now 50 million people or more in the United States have gotten this vaccine. And there's no evidence that it has been linked to any deaths. One point to make, imagine 50 million people, with most of those people being more than 65 years old, getting the vaccine. There may be some of those people, and particularly very elderly, who die after getting the vaccine, but who die from natural causes, other causes. And there's been no link to the getting the vaccine and death. So, and as a matter of fact, COVID is a much higher risk. Of all the people that have died in the world, and mostly in the United States, this data, 80% have been over the age of 65. So the mortality rates are very high. And so this vaccine is very good for that group.
Ms. Loveluck, can I just ask a clarifying question to Dr. Cinti? So Dr.
Yes.
Cinti, you're saying that the vaccine is very, very safe,
Yes.
that nothing is 100%, but compared to actually getting COVID, there's no comparison.
No comparison.
Okay, so it's much, much safer for you to take the
Yes.
vaccine than it is for you to risk getting COVID if you're over 65. Am I understanding you correctly?
Yes, absolutely. Okay. I've told my father, his wife, all my family members who are over the age of 60, as a matter of fact, I told everybody in my family, get the vaccine. Yes, thank you for clarifying, Erica. Dr. Marsh.
Thank you, thank you.
Yeah, that was very helpful. And as we know, many people have other kinds of chronic conditions or are taking medications for other reasons. So here's a question about asking what kind of research has been done on the population who are on many different prescriptions and then are getting vaccinated or considering getting vaccinated.
The data, so the data is on people who are over the age of 65, and everybody in that age group, no matter whether they're healthy or they have a lot of medications, and a lot of those people are on medications. There has been no medication that would be that you or a loved one would be taking where we would say you can't get the vaccine. And in the trials, there were people on all different kinds of medications.
Yeah, I think we certainly get a lot of questions about the safety of the vaccine, especially because it was developed so quickly. And this is kind of in line with the last question, which is a really important clarification, I think, in terms of contraindications to get vaccinated.
Yes.
So are there any health conditions or any treatments that someone might be going through or participating in that would preclude them from getting vaccinated, or there's a contraindication? I think that's a really important clarification also.
It is, it needs to be known. And the answer to that is only one or two. One is if you have had the vaccine before, the Moderna or the Pfizer, and you have had one of what's called an allergic reaction, where you get, many people have seen people with peanut allergies or allergy to shellfish, throat closes up and rash. About 6 per million people, 6 people in 1 million will get that reaction with Pfizer or Moderna. We've had that happen and people do fine. They get a shot and they're better. But if you had that reaction, you would not be able to get the second dose, or you would have to go to your allergy doctor first before getting the second dose. So that's one. And the other one is if you are allergic to any component, if in the past you got a component of Moderna or Pfizer, and you can read those on there, then you would not be able to get the vaccine. But everybody else can get the vaccine. There's no medication, there's no disease that would say you cannot get the vaccine. One point to make, if you got another vaccine, so if you got your flu vaccine or your shingles vaccine, you have to wait 2 weeks to get the COVID vaccine, but you can still get it.
And I think the other important thing to remind people is that when we do vaccinate we use the COVID-19 vaccine, we monitor people after they get vaccinated.
Right.
So we actually have them wait for a period of time to make sure that they are okay and not having any reaction.
Perfect. Yes, that's right, Jimena. Oh, and if say you had a peanut allergy, or maybe you had an allergy to penicillin at one point, then we'll make you wait a little bit longer, 30 minutes instead of 15 minutes. So absolutely the important point to make. And within that, and if nothing happens within that time period, you're safe and you can go home.
All right, thank you. Here is a question from a sort of broader public health perspective in terms of some of the actions and openings that have been happening with our businesses and our economy. So, should we expect the number of people who will contract the virus to increase now that Governor Whitmer has opened up more of the state? Are we at greater risk for contracting the virus from restaurants as opposed to Walmart?
I'll start, and then Jimena, I think you probably want to weigh in on this too. The answer is there's a bigger risk within the restaurants. Remember, when you go into a restaurant, you have to take off your mask. And so whenever you take off your mask, there's a little bit more risk. Now, as we have fewer and fewer people infected in our state, the risk goes down, but there's still a risk. Going to Walmart, wearing your mask and passing somebody in an aisle is not risky at all. or a little bit of risk, but not very much risky. And as it is if you go to a restaurant. Jimena, do you want to weigh in on that? And Erica too.
Sure. So absolutely, that is why it took a long time for our community spread and metrics to get much better before we saw indoor dining open again. And even now, indoor dining is open with many restrictions in order to make it as safe as possible. So we have restaurants that have to operate at 25% capacity. People can't sit more than 6 at a table. There's a curfew as well. Every restaurant has to close by 10 p.m. Those are all measures to make that as safe as possible. But absolutely, there is a greater risk with indoor dining than, as Dr. Cinti mentioned, going to your Walmart, your local grocery store, wearing your mask, coming in and out. And even with the vaccine and more people getting vaccinated, we in public health are always making sure that people remember to still practice all of those prevention measures that we have been recommending since we started having COVID-19 in our community. Wear your mask regularly, practice social distancing, wash your hands frequently. Dr. Marsh, anything that you would like to add?
Thank you, Ms. Loveluck. I think you and Dr. Cinti nailed it. I would just add that a lot that we've learned about COVID is about choices. Choices that we make and choices that we don't make. And this question represents, you know, some important choices that we have the opportunity to make. We've all felt so constrained over this last year. We all want to get out and stretch and be social and engage and get our lives back. But I think we have to make the decision or make the choice to keep ourselves safe, to keep our families safe, and to keep our community safe. And we do that by really doing the same things that the CDC and our governor and our local county governments and our healthcare providers have been encouraging us to do for quite some time. Social distancing matters. Wearing a mask matters. It makes a difference. Washing your hands matters. Not touching your face matters. So I would say we all welcome a life where we have choice again, but we're not quite in a space where we can see COVID in the rear view mirror. We're still seeing COVID with us, in front of us, beside us. And because of that, it's going to be very important, particularly as things start to open up, for us to make responsible choices as we leave our homes. Thank you.
That's terrific. And just you make a great point about the governor. She is one of the best governors in this country. And if you look at the times that she, and with public health, with Dr. Calhoun, they both work together to make sure to bring down the COVID problems. And all of you can look at the curves and see that the times when she was able to do what she thought was right, there was a moment there where she was not allowed to make these restrictions and the cases went back up a lot. We were one of the best states in the country until that happened. It was only until she and the public health establishment here were able to do what they were supposed to do that it came back down. So trust the governor. I think she's making decisions based on science, and we'll see how this goes. I am a little worried about restaurants, but I trust the governor and I trust our public health people here.
I agree. And I think she's demonstrated the courage to make the safe decisions and the right decisions and not necessarily the easy decisions.
Right.
And we've reaped the benefit of that by, seeing our case numbers go down precipitously compared to many other states. We're safer and healthier because of the decisions that she's made. So I agree with you.
Excellent points. Thank you. So with the 2 vaccines that currently are approved with Pfizer and Moderna, we have 2 doses that are required. With Pfizer, it's 21 days apart. With Moderna, 28 days apart. And there's a question about why are people experiencing more symptoms or side effects from the second dose of the vaccine?
It means the vaccine is working. What happens is when you get the vaccine, your body is told to have a response. And so it builds up the cells that will fight the infection if you are. The body recognizes, oh my gosh, maybe this is the virus. It's not the virus. We all know that. It's the vaccine. And so the body again ramps up its ability to fight the virus. And that is the symptoms you're feeling. And now people will ask, well, I didn't get that. Did I not get protection? The answer is no, you still got protection, but there are some people who will get more symptoms. And I've seen it the other way around. In the studies, most people had worse symptoms with second dose, but it's the same type of symptoms. It's pain at the shoulder, it's muscle pains. A few people, about 15%, get fevers. And we've had at my work, we've had only a few people who have had to stay home for 1 day because they had a fever, but then we're back and fine the next day.
And we had that similar experience.
Yeah.
With our staff, our vaccinators and nurses. There were a few who had a rough 24 hours, but again, it passed. And as you say, it's a sign that the vaccine is working. Affect people based on gender and also race.
That's a good question. Is there a difference? There really is not a big difference. The difference is mostly with age, with the younger people having more symptoms from the vaccine, but it does not have worse effects in any race, particular race or gender.
And Dr. Cinti, can you say any more about clinical trials that are happening, that are still being planned or that currently are starting? We've heard that there are now going to be clinical trials with children, and I believe with pregnant women.
Yep.
So just wondering if you could talk a little bit about that.
Yes, both of those trials are ongoing. Now, regarding pregnant women, there are trials that are going on, but the pregnant women are getting vaccinated, and the vaccines are predicted by both physicians, by OB/GYN, to be safe. And there's no reason to think that these vaccines would hurt pregnant women or the babies. Children will likely do very well with these vaccines also. And you have to imagine that if we want to get, as Jimena said, 70% of people vaccinated, we have to vaccinate children in order to achieve that at some point. So that will be important. And those studies are ongoing.
Thank you.
I will mention also, there are studies looking at the one side effect, which is the allergic response. There are studies going on at University of Michigan. Dr. Jim Baker is working, he's an allergist. He is working on that so that people with an allergic reaction can maybe still get their second dose and potentially get other vaccines in the future that are made the same way as Moderna and Pfizer.
And obviously so much research going on that, I mean, from the beginning of the pandemic, we certainly have learned a lot in a very short time. And the research obviously continues. So is there research being done on those who get the vaccine to see who is or isn't making antibodies?
Very good question. Yes, the answer is yes. They are doing those studies. They're looking at antibody levels, and not only antibody levels. On top of antibodies, there are other cells in the body which are called memory cells that remember that you were vaccinated and are able, maybe a year later or even longer, to still protect you if you get infected. And so researchers are also looking at those cells to see how long people keep those cells. So yes, there's intense and a lot of research still going on about these vaccines, and will continue for years, maybe decades going forward.
Jimena, can I ask a related question to that? And it may be one you're about to ask, but given that we don't have a full understanding of what these memory cells are going to remember or how long they're going to remember it, what is the likelihood that we're going to have to take the COVID-19 vaccine more than once? We take the flu vaccine every year.
Yeah.
Do you think that this is going to be a vaccine like that, Dr. Cinti, that we will have to take every year, every other year? What are your thoughts?
So it's a very good question. And the answer is we don't know completely. I do think that we will be getting boosters for the first few years because, and the reason is, we are already seeing changes in the virus, and people have heard about what are called variants. There was one in England that has now come to the US. There's one in South Africa that has now come, that has come to the US. And those have been little changes. Now the vaccine will still protect you. It might not be as efficacious, but it will protect you from getting very sick and ending up in the hospital. But they may change, the companies are changing the vaccine a little bit to be able to give what's called a booster dose to be able to protect from those strains. So the answer is probably yes, Dr. Marsh. Maybe in the future, coronaviruses do not change as much as flu viruses, which is pretty well known. So I think that's still to be seen, whether we'll have to get a new vaccine every year, maybe every 2 or 3 years, maybe every 5 years. Most of you know that if you've been vaccinated for, say, tetanus, that when you were vaccinated as a child, 5 years, 10 years later, you have to get another one. So it may be something like that. It might not be every year.
And there was a second part to that last question, which is if someone doesn't make antibodies to the vaccine, how will that be handled?
That's a very good question. And there are many vaccines. As an infectious disease physician, I give a lot of vaccines, and I give vaccines to people who have immune problems, very particularly people with HIV. And some people with HIV don't make antibodies as well. Now, even having said that, we still give them the vaccines and they do fine. Even though sometimes when we check the blood for the antibody, it might not be there, but they still are protected. And that is because of these other memory cells that we don't test all the time. It's very difficult to test those. The tests to do that are very expensive, so they only do that in a study. But there are many other parts of the immune system that aren't only antibody that the vaccine helps to lift up.
So moving on to the next question, how do we know this won't kill or maim us?
The vaccine, yes.
Yes.
We know from the studies, and like I said right at the beginning, I think the first question was the question about how long do we have to wait before we can say it's safe? And 2 months is a long time in vaccine research, and it has been very safe. I feel very comfortable taking the vaccine, and I did. I feel very comfortable giving it to my family members, and I will when they can get it. Make sure that they get it. And if you look at other vaccines, it's very similar in safety to other vaccines. There was a concern because this is a piece of what's called mRNA, that this would get into people and change their DNA. It would change them in a certain way. It doesn't do that. This little piece is a message. It goes into the cell, but not into the part of the cell that causes genetic changes. It stays outside. And then as soon as it does its job, it's destroyed right away. So there is nothing that's left of the vaccine. So the research, and I suspect, and this is very likely, that many future vaccines will be mRNA vaccines. So they are safe.
It might also be helpful to share some of the processes that are in place to report adverse events related to vaccination, as well as the monitoring that's happening for people who have been vaccinated, so that there's sort of a following of people to see how they do even further down the road after being vaccinated. Could you talk a little bit about that?
Absolutely, and I'll let you will add to this, I'm sure, Jimena, because that is an issue I know you're dealing with all the time. When somebody when you get your vaccine, you will get a little paper that tells you who to contact if you have a side effect. And that report goes nationally to our CDC, our Centers for Disease Control. It's called the VAERS, the Vaccine Adverse Events Registry. It's the place where all the symptoms, even if you think it's associated, if I get a vaccine and the next day I get a very bad cough, I can put that in to the system at the CDC. And these patients that are dying, even though their death has been found not to be associated with the vaccine, they will be put into a system where they can look at that. And that continues. Every vaccine adverse event, so any bad event from a vaccine or near a vaccine, will be reported. The CDC also has it's called vSafe. It's an app that you can put on your iPhone, and then you can go in and report when you have an adverse event or a side effect. Jimena, you want to expound on that a little bit?
Well, I'll just share that that information is certainly incorporated into our vaccination clinics. And so anyone who's coming through getting vaccinated, you get that information. And in addition, for the health department, when we have our clinics, we have kind of an education station as well. So we have a video that we've developed, and that really helps people learn more about not only the vaccine, but also these other resources, so that if people are interested in signing up for this app that you mentioned, we have the ability to help people do that and provide that information. And it's really contributing, obviously, to the knowledge about the long-term impacts of the vaccine and its effectiveness.
Right.
So this next question is great, because it's very much in line with what we were meeting about earlier this afternoon. So here's the question: why not give U of M the majority of Washtenaw County's vaccine, since they have an entire stadium and a multitude of qualified people to vaccinate already set up?
The answer to that is multifocal here. I think the way public health is set up in the state, they really are the ones that are best at giving vaccines. And we are in a good place to be able to be very helpful in giving vaccines. We were very good at giving vaccines to our workers in the hospital. And so when we initially got vaccine, we were able to do that very quickly. Public health has a lot of help too, and people who are willing to vaccinate, and they have the convocation center and a lot of places where vaccine can run through very quickly. So I don't think it's right that I don't agree that public health can't do the mass vaccinations. I do agree that the hospitals are in a good place to be able to help and to be able to do that. There's nobody like public health though that will get out there and make sure that the populations, that the vulnerable populations get vaccinated. We try at the hospital, but in the hospitals realize that there's a lot of desire to vaccinate your own patients. And that isn't always consistent with the vulnerable populations in your area. So I think there are many reasons why both of us have to work very closely together. And that's why, again, we were meeting today. We meet twice a week with Michigan Medicine, with the public health, with St. Joe's, with IHA, and the VA too is in our meeting. And we all talk about these issues. How can we do this the best? How can we do it the fairest? How can we reach the people that need to be reached? So Jimena, you might want to weigh in. I'm sure you want to weigh in on this too.
Yeah, well, that's a great start. And absolutely, as I mentioned in my beginning comments, the health department plays a key role in coordinating our vaccination strategy at the county level. And also as local health departments, we are responsible for mass vaccination efforts. That is a key role that local health departments play. Of course, we can't do it alone. We need our hospital partners, we need our community partners, but also as we think about the eligible populations, obviously Michigan Medicine, IHA, St. Joe's have many patients who are 65 and older. But as we think more about getting to other frontline essential workers, we have to think also about how to reach them in an accessible manner. And so as we get through to other populations, we're looking at other strategies beside mass vaccination clinics. We know that it's really important to have community-based clinic or community-based vaccination efforts available. And we know not everyone can get to those big clinics. So that's what public health traditionally does, is really be very grounded in the community and in really addressing not only the needs of vulnerable populations, but ensuring that we work from an equity framework. So it is something that we are all working on together with Michigan Medicine and other hospital partners. And of course, very much hoping that our vaccine supply continues to increase so that we can get through our eligible populations as quickly as possible.
Yeah.
I would just add to that I think trust is a key component of getting vaccinated. And while, and I say this as a Michigan Medicine physician and faculty member, we certainly work incredibly hard to create a posture and environment where our patients feel safe, feel welcome, and where all patients feel safe and welcome. We know that there are segments of the community that don't feel welcome here, unfortunately, and don't know us and don't trust us because they don't know us. So we have to, in the spirit of making sure that everyone in the community has access to the vaccine, it's incredibly important that we use efficient measures, like the fact that U of M can immunize hundreds and hundreds and hundreds of people in a day, but we also have to use effective measures for people who are not willing or not able to come to campus, for whom parking, for whom transportation are hurdles and barriers, for whom language is a barrier, for whom culture is a barrier. And going, I just want to highlight the importance of what Jimena mentioned in terms of having community. That's really an opportunity and speaks to the necessity, quite frankly, of community-based vaccination sites. It's very efficient to have people come to a big center, but it's also incredibly effective to have the center go to the community sometimes and make sure that we're addressing issues of equity, of access, of respect. And I think it speaks to the fact that both approaches are important, both are necessary, but we certainly can't lean on one of them exclusively, because people will get left out if we do.
Right. Well said.
So Dr. Marsh, do we have time for one last question? Or should we wrap up here with the questions?
Is it a short one? We can squeeze in one short one before we wrap
We'll
up.
keep the answer short. How about that?
All right.
So how does Washtenaw County determine the quantity of vaccine to give various organizations like U of M, Rite Aid, and MICHR? And you know what? I'll just jump in here and say, first of all, that there's a federal pharmacy program. And so the pharmacies that are getting vaccine are getting that directly from the federal government. It's not coming from our county allocation or, the Michigan medicine allocation. So it's coming directly from the federal government. And in terms of how we allocate vaccine, that's what we talk about in our coordination meetings, because we want to ensure that based on the population, based on the numbers that we know of who is eligible, we want to make sure that we apportion vaccine supply accordingly to enable those who are providing vaccine to reach those who are eligible, like Michigan Medicine and St. Joe's and other places. We expect soon in the coming months that there will be many more places where vaccine will be available as vaccine supply increases. And I'll let Dr. Cinti add any 2 cents that he has to that.
That's perfect, Jimena. I think we have to keep working together, and that has been a good interaction.
All right, we squeezed in the last question.
We did. You were masterful, Jimena. Thank you.
Yeah.
So on behalf of MICHR at University of Michigan, on behalf of the Michigan SEAL study group and its steering committee and its funded work entitled The Fierce Urgency of Now, Communities Conquering COVID, in partnership with Alfreda Rooks and Michigan Medicine and her office, her extraordinary office of community service, and all others that helped make the event tonight successful, including Professor Maria Militzer and Ka Snyder, our translators who are both available to help improve the access of this event. I want to say thank you for joining us, with a special thanks to our 2 incredible experts and speakers tonight, Jimena Loveluck and Sandra Cinti. We know how busy you are at this particular moment in time. We appreciate the work you do to keep us, our families, our communities safe. We know that this is a marathon and not a sprint, and we have many rivers to cross yet, but we also know that we are better off with you on our side. So thank you so much. My name is Erica. I just got a text saying you never introduced yourself. I apologize. My name is Erica Marsh. I was just happy to be here with you. My name is Erica Marsh. I'm a on the faculty in the Department of OBGYN at Michigan Medicine and Michigan Medical School. I serve as Director of Community Engagement for MICHR, the Michigan Institute of Clinical and Health Research. I also serve as Director of the Onward Team, Women's Health and Reproductive Disparities Research. And on behalf of all of those respective teams, as well as the SEAL team on which I serve as co-PI with Barbara Israel, and an incredible steering committee from across the state, I want to thank you for joining us. We look forward to seeing you at next month's town hall. Keep the questions coming, keep the engagement coming. We want you to join us. We want you to ask questions. We want you to feel empowered and know that you're making a safe choice and the right choice for you, your families, and your communities. So thank you all of us, thank all of you for joining us. Please email us with any questions or comments at kwikwi@umich.edu. That's KWI@umich.edu. And we will be translating, summarizing the Q&A in English and in Spanish, and distributing that PDF to any folks who want a summary of this evening. And again, we look forward to seeing you next month. Thank you. Be safe and be warm. Take care.
Bye.
Thank you.
Bye.
Buenas
Thanks,
noches.
everyone.